So this is a really exciting time for the treatment landscape of HER2 positive breast cancer with multiple new agents approved and on the horizon. Currently, we use a taxane plus trastuzumab and pertuzumab in the first line setting, followed by TDM1 in the second line. Following progression on TDM1, there was no single standard of care regimen prior to the recent approvals. And so just this December, we heard about the approval of trastuzumab deruxtecan based on the impressive results from the phase 2 single-arm study presented at San Antonio. And then in February, we heard also about the approval of neratinib in combination with capecitabine after 2 or more lines in the metastatic setting based on the results of the NALA trial. And then most recently, based on the results from the HER2 CLIMB study, we also now have the approval of tucatinib in combination with trastuzumab and capecitabine for patients with metastatic HER2 positive breast cancer with and without brain metastases. And the labeling actually allows for us to use this after 1 line of treatment in the metastatic setting. Other agents pending FDA approval include margetuximab based upon the results from the SOPHIA trial, and also the Monarch HER2 study was recently published in the Lancet Oncology by Dr. Sarah Tolaney, showing that treatment with a combination of abemaciclib plus trastuzumab and fulvestrant resulted in not only an improvement in progression-free survival, but also a tolerable safety profile compared to chemotherapy with plus trastuzumab, which provides support and offers a potential chemotherapy-free regimen for patients with advanced breast cancer. So, with all of these new agents and drugs and trial results that we've heard about recently, it's a very, very exciting time. All of these options has really expanded the treatment options that are available to patients. Especially after the first and second line setting, the results from the Destiny study regarding trastuzumab deruxtecan is very impactful in that we saw a tremendous benefit in patients, although we haven't yet seen a survival benefit with that drug. In terms of the results from HER2 CLIMB, we saw both a progression-free survival benefit as well as an overall survival benefit. And also, that trial included patients with brain metastases. So we now have a new systemic treatment option to target that problem, which is of much great need in this patient population. So I think certainly this has an impact in terms of our clinical practice in that we're able to offer patients these new treatment options that have recently been FDA approved.